Hey yo, everyone, gather around. It's story time. Brought to you by the University of Alaska Fairbanks, Department of Social Work, and a Conscious Party Productions. You are listening to The Critical Social Worker, a revolutionary storytelling podcast.
A conscious party.
Revolutionizing our minds.
Elevating our consciousness.
Changing our worlds.
Your story.
My story.
Our story.
Yeah, so my name is Amana Mbise. I'm originally born in Tanzania. Tanzania in Africa, East Africa in particular. And I am a member of a tribe called Varwa. Or at least the government of Tanzania doesn't call us that. They call us the Meru people, but we call ourselves the Varwa tribe. We're a small tribe of about 150,000 people.
Wow.
And so I was born there in the northern part of Tanzania. For those of you who might be familiar with the map of Africa, so East Africa, we are in the north part of Tanzania that borders Kenya. So to the north is Kenya, and northwest will be Uganda, and then to the west of us will be Rwanda and Burundi, and the southern part is Mozambique. So that's kind of the map. There's a little bit of the southwestern corner that borders Zambia and Malawi. So that's kind of to paint a picture of my country. And so I was born there, and one out of a family of 8 kids. And I went to school there pretty much. And in college, I did my undergraduate at the University of Dar es Salaam, which is on the coast. So again, the eastern part of our country borders the Indian Ocean. And so this is the coastal town of Dar es Salaam is where I went to do my undergraduate in sociology. And so after that, of course, I worked, and then I ended up doing my graduate education in the United States, but we can talk about that later. So, so those kind of formative years were in Tanzania. I grew up speaking my tribal language, Kirwa, and when you start primary school, they introduce the national language, which is Swahili. And then when you go to high school, they introduce English. So I after primary school, I took a different path anyways. So I went to a private primary school, so I got exposure to English a little bit earlier than if I continued with the national education system. So there's a little bit of a deviation there. So that's me growing up in Tanzania, and happy to take any questions if anything comes up about that background. Yeah.
Do most people in Tanzania, do they speak 3 languages?
Yeah, typically that would be it. For people who have, I think if you've gone beyond high school, most people are comfortable with English somewhat, but 96% of the population would at least have Swahili as their main language. And then very few who have gone to high school and university will be comfortable to speak, I think, English. But the majority of them would have different tribes. There's about 123 different tribes. So that's as many languages, 123 different languages and cultures, right?
I think we here in the West, in America, we make the same mistake that folks often do with Alaska. You know, when you're talking about Alaska natives, think it's just an Eskimo or something like that, and they think there's one people up here, or even with Native Americans for that matter, you know, in the continental United States. I think people look at Africa the same way, like Africa's just one group of people, and they don't see all the diversity.
Oh yeah, I think it's a known fact that Africa is perhaps the most genetically diverse, culturally diverse continent. That even within one country, we are very different. Tanzania is a multicultural society. As I said, just of those 123 tribes and so many languages. And so we are fortunate in that, unlike other African countries, we at least have a national language that unifies at least the majority. Not everybody speaks Swahili, but at least we had a national language which all these different tribes were unified by. That is not true of other African countries. For example, just in Kenya, you speak Swahili, but it's not as widely spoken. So in other countries, of course, it will be tribal languages, and then the national language would be a foreign language, it would be English or French or something, right? One of the languages of the colonizer will be that. But I think we are unique in that we have Swahili as the largest African language, which is really not owned by a single tribe. So no tribe can claim that we own Swahili. Some people maybe along the coast could claim that, but we're fortunate in that regard. And so Swahili is in itself a compound language. It's made up of different words that are borrowed from different languages. There's the Bantu. It's a Bantu language of the Bantu tribes, but it's also got a significant amount of Arabic in it. Just because of the early contacts with the Middle East, it's often referred to as a language of the traders of the Indian Ocean, right? So the Indians and Arabs got together with the local Africans and the Bantu tribes, and so that influenced the modern day language of Swahili. So,
wow. So do all the different languages, are there similarities? Can folks from different tribes or that speak different languages, is there any understanding at all, or are they completely different?
Yeah, that's a good one. There's some similarities depending on if the different tribes are neighbors. There's some of that, but also if they come from the same language family. So Bantu languages, which is the largest sort of ethnic group in Africa, they would have some common root words, a mother, a person, I would say in my tribe, we call a person up because it's a predominantly Bantu language, a Bantu tribe. A person is Mtu. There's different versions of that. If I go to the Congo, if I go to Kenya, if I speak to somebody from Zimbabwe who is a Shona, I can understand. All right, there are some common languages. If I go to Zambia, if I go to other Bantu origin, that is true that we can understand each other. So there's some connections. I can understand the neighboring tribes. My tribe is also heavily mixed with the Maasai tribe, so I can understand Maasai languages. So there are those sort of cross contamination between the different tribes. And Swahili has, anyone who is of Bantu would have quite a bit of the Swahili vocabulary already understood. So, and Arabic, if somebody speaks Swahili, there's a lot of Arabic in Swahili. So I understand a little bit of those of Arabic. Similarly, if somebody from who's Arabic would find it very easy to learn Swahili. And so that's just the because of those historical contexts. But you'll be surprised that Swahili, because of the contact with the Europeans, there's a little bit of Portuguese, there's a lot of English, of course, and there's German in it. For instance, when we go to school, in Swahili, a school is a Schule. A Schule, that's German for school. We call it kindergarten, right? That's very German. A table in Swahili is mesa, is a mesa, which is really Portuguese for table. So because of those contacts with the Arabs, and of course Arabs is a bigger part of the Swahili language. There's a lot of those similarities. Yeah.
Yeah, it's interesting how languages can get mixed together like that, depending on who's there and immigration and moving around. And I lived in Hawaii for a while, and they have what they call pidgin. And, it's a mix of everything. It's a mix of Hawaiian, Japanese, English, Portuguese, like the same. And it's just interesting how many different influences historically, and then it comes up and they have a language that's made together that nobody, sat down and put together. It just naturally evolved and came.
Yeah, and sorry to digress in this, but I think it's been a blessing for my country to have a language that really doesn't trace any tribal roots, because tribalism and ethnic-based affiliations are very strong in Africa. And so what you realize is my country has partly avoided some of the political violence and intertribal conflicts, partly because of having a unifying language. This is not true of a lot of other African countries. For instance, I think you might have heard of the Rwanda genocide, the tribal conflicts in Kenya and other countries, where you have a dominant tribe that not only dominates economically, but it also dominates linguistically and so on. And that hasn't always been smooth, the relations between those countries. And one of the reasons is there's really no unifying language. And so what countries in Africa right now are doing is copying the Tanzania model of having a local unifying national language. So South Africa is teaching its people Swahili. Kenya has that, building Swahili as a way of building cohesion between the different tribes. Rwanda itself, right? They are doing that in so many other countries. So I think right now we don't refer to Swahili as a national language. It's really an international language that is crossed different countries. So.
Well, you mentioned the benefits of having a national language. Do you think it's also important to preserve the tribal languages?
Oh, that's awesome. That's a good question. Yes, very much so. I have children, and I don't think they'll be able to speak my tribe language. And that is very sad. We have those 123 different tribes. By the way, not all of their languages are able to compete with Swahili, right? So Swahili is now becoming the dominant language. My son, my children, their first language now, unlike mine, is Swahili. My first language is my tribal language. So that's an example of how it's getting lost, and I am trying to speak with them the tribal language. Send them to my grandmother. My grandmother speaks very little Swahili, and hopefully that can make a difference. But I feel we're fighting a losing battle. The truth is, even in my generation, we've lost that connection to our tribal languages. And I said my tribe is 150,000, we are still very actively speaking our language, but it is very much being threatened by the sort of the globalizing power of Swahili and even English. You see, uh, but so it's very important that we speak to our children. For those of us who still have that tribal language and are native in it, can speak it, that we can speak to our children and find ways to preserve it. Fortunately, my tribal language was not a written language, primarily oral language. That is a lot more difficult to preserve. As the older generation is dying, then that is getting lost. But we have a little bit of a fortune because the missionaries, when they arrived, they actually were first to actually write the language. And so that, in a way, had perhaps, I don't know whether that was their intended consequence, but the unintended consequence is it's a way that it has preserved the language. We can read the Bible in our tribal language, but that's the work of the missionaries, right? If anything good comes from missionaries, right? Yeah, that was one good thing that came out of it. So I think the more that it can be written and preserved in various ways is really important, because the powers of bigger languages is intense, is really big, and I even feel sometimes I'm failing to pass that on to my children. So definitely we need to preserve these languages. But we have to do so much more in terms of writing it, in terms of speaking it to our children and documenting it and recording it, right? So they can hear. So even if they won't be using it, at least we are depositing those sounds in their minds. We speak it, at least they can hear a little bit of it. But it is hard, especially for smaller tribes. Yeah.
I can imagine. So, I've heard a lot of folks reflecting on, trying to keep language alive. I know several Alaskan Native folks that, have been working very hard in it, but it's hard, because it takes immersion for the most part. And it's like a muscle, you have to practice it. And I know from personal experience, trying to learn other languages as an adult, it's hard, it's difficult. You can pick up words and whatnot, but actually having a conversation and understanding folks is a whole nother, it's a whole nother level. So, but I think you mentioned it too, technology, you have, fortunately, technology's arriving at about this point where we have, just like this, we have many different ways to preserve the knowledge or the languages.
Right. And I firmly, took me a while, but when I had my children, I think it must be somebody I was talking to, and they're like, it doesn't matter whether they understand. As long as you are speaking so they can hear and deposit it in their brains, at some point they might be able to activate it, right? So I think just the power of speaking and depositing those words in many ways, whether we capture that through, podcasts such as this, such as the written word, such as orals and stories, right? Those stories that can be narrated. And as you said, like technology is great, like audiobooks and so on. So we can preserve those sounds, which then can be deposited in our children and future generations, is really how you keep it going. So, yeah.
Thank you for sharing that, and move forward in just a minute. But I want to stay here. I want to ask a question kind of on behalf of my wife, and she might be listening, but she might be busy with the children as well right now. But she is British, but via her father and his parents moved there from Jamaica in, I think, the 1950s. And she has done it, she's tried to look into her background, trying to find her roots and trying to find connections here and there. But it's really hard because even her last name, Hull, is named after a slave port. And so there's not a lot of records, obviously, on things. And so she's tried to find, connection to where she's from and whatnot. She did one of the DNA tests, and she found out,
Yeah.
traced it to
23 and me or something. Yeah.
Yeah, she traced it to Nigeria, and so I guess what I'm trying to say is that she's this person, well traveled, but over here in the Western world, trying to reconnect, and she's done a very good job. She's in the I don't know how long I've known her now, 8 or 9 years, and just to see the connections that she's made and the work that she's put in has been really gratifying and impressive from my stance watching her and observing her. But as she seeks that, my question to you is, now that you're over here in Alaska, what is your relationship to Tanzania and Africa? And what is it now, and how do you see it in the future? What does it mean to you?
Good question. So I think for me, I feel, again, thanks to technology, on a daily basis, I kind of occupy two worlds at the same time. I can speak with my family. By the way, my family is currently they are back home in Tanzania, so that's another reason to to still be connected. They were here, but they're back. I have with my kids. So because of that, WhatsApp is a big way that we communicate. So right now it's a 12-hour difference. So when they wake up, going to school, I know they start classes at 8. So at 8 o'clock, I can assure you I'll be on the phone with my kids in Tanzania, trying to make sure they go to school, right? So that has really helped me to still be connected. But most of my family is there too. My both of my parents have passed, but I have my mother, who once my biological mother died, my father married my aunt. That's another story for you guys. So that's my mother. So she's taking care of us. And so I feel that connection still to the land and to the family. I try as much as possible to at least do a trip once a year. I think that was disrupted because of COVID a little bit, and so but I try to go back at least once a year when I can afford it. It's not cheap from here. So that has meant that I'm able to really go back and forth, but also because everybody's there, my family is there. I'm the only one who ventured beyond, outside my country. So everybody else is there. So because of that, I haven't really lost that connection. Now, do I still go back and people think that I'm an outsider? Yeah. Sometimes they think, oh, well, are you really from this tribe? And then when I speak the language, they would question like, "Oh, we didn't even think you still were able to speak the language." And I'm like, "Yeah, I do." So there's people who are surprised whether I'm still a part of that community, but I see myself as very much a part of the community, and I have land there as well. Land is a big part of connection to the community, and for my tribe, land is really what connects you to your people. And we have lived in the same village for as many generations as we know, and so for me that is home, the physical space of the land that I own, but also because of the family and the relations that I have, and so I'm able to maintain those connections because of just the way technology is and my family being there. And so I think it is for your wife. It would be, what if I didn't know an actual tribe, right, where I came from, and if I had to do a DNA test and ancestry.com like this, right? That's one way of trying to find that community. However, because I was born there, I already have that land in my community. I think I'm able to trace it that way much more clearly. But yeah, but as we all know, those of the because of the transatlantic slave trade and so on, Africans were taken from their home and they ended up here. So we're all in the diaspora as to we know there's a place if we can connect to where we came from. That's another power of technology, that we're able to really know where our ancestors would have come from. I think that's a powerful thing. That's really important, and I commend your wife for wanting to that connection for you guys and for your family. Yeah.
I appreciate that, and I appreciate your answer.
Yeah.
I wanted to remind everybody in the audience, I know that some folks are going to be calling in. Feel free to do that at any time. We were already 25 minutes in, so if you feel like you want to jump into whatever we're talking about, feel free to hit the call in or use the chat box. So from Tanzania, you went to Denmark after that?
No, I came to the U.S.
Okay. Tell us about it.
Yeah, so I came to the United States for school for my graduate education. I studied social work, MA social work. However, as I had mentioned, my first degree was really in sociology when I started back in Tanzania. And soon after I graduated with my degree in sociology, I started working with in the community with people living with HIV/AIDS. So I was involved with community-based HIV/AIDS programs. And through that, I was able to meet a professor from the University of Illinois in Chicago. He was a social work professor, and he came down there. And we would go out to the field from the city of Dar es Salaam. We'll go out into the different rural areas to train people on how to work with families that had been affected by HIV/AIDS, as well as people who are living with HIV/AIDS, and the families and the children. And so what had happened back in the 1980s, with HIV/AIDS in the 90s, something like that, ravaged many communities. And among those, Tanzania was highly impacted by HIV/AIDS. And so when I finished my undergrad, like 2005, around 2006, 7, 8, I started working in the area of HIV/AIDS because it was a huge problem, still is a big problem in my country. And so with that, we would go out to train paraprofessionals, what we call parasocial workers, kind of like community health workers, who will go into these homes and talk about HIV/AIDS, how to prevent yourself, how to stay safe, how to seek support, and so on, and also address community-wide stigma against people living with HIV/AIDS. And so that was what we were doing at the time. And so in 2000 sometimes like 2010, this professor tells me, Amana, I think what you're doing is mostly social work. It's not sociology. Okay. I had no idea what social work was. I mean, I had heard of a little bit, but really didn't have much to say about social work. But it made sense to me that a lot of sociologists would want to study problems and not do anything about them. And here I found a profession that was actually doing something about social problems. And so that was very much in line with what I was already doing in the area of HIV/AIDS. And so he said, this is something. I think you're good. You're doing great in HIV/AIDS area. How about, have you thought about a graduate degree in social work? So really that kind of sparked the interest. And I said, for sure, I'd love to do go and get a master's in social work. And then I applied to the University of Illinois. And he was like, yeah, if you have any questions, please ask. I'm happy to help. And so I put in my application in 2010, and a lengthy application. You have to pay all sorts of fees and go through tests and do GREs and do the test of English as a foreign language and so on. And then as an international student, of course, there's all these things that these hurdles you have to clear. And so fortunately, I was admitted into the Master of Social Work program at the University of Illinois, the Jane Addams College of Social Work. So it was really fitting that I'd go into a school named after one of the pioneers of social work, right? And in a city where Jane Addams did most of her social work practice. And so it was wonderful for me to connect my practice experience with people living with HIV/AIDS and doing social work, and being able to really understand what it is that I was doing from a theoretical framework kind of perspective. So that's how I ended up. So had I not met Professor Nathan Linsk, who is a premier scholar in the areas of HIV/AIDS and social work, perhaps I would have ended up somewhere else. But yeah, so I think it matters who you meet, right? Sometimes along our path, along our career path, that was the difference in my pursuit of education, but also ending up in social work. It was because of Nathan Linsk telling me about social work and the work, of course, that I was doing, connecting very well to a social work profession. And so I did that, and I graduated in 2012 and moved straight into the PhD program there. So that's kind of how I ended up in social work. And of course, the piece about Denmark came in 2014 when I moved to Denmark. And so I had gone to Denmark around 2014, 2015, and I lived there working primarily in the areas of immigration and refugee work. I worked with the Red Cross, volunteering with unaccompanied minors back in Denmark. But that was an interesting time, because in the year 2015, if you might recall, there was a huge influx of refugees and immigrants who were coming into Europe. And Europe framed this as a huge migration crisis. And I was there at the time. And so they really wanted people to work with these unaccompanied minors. I worked with children from Afghanistan, from Syria at the time, 2015, a lot of them. There was what was then referred to as the Middle Terror. A lot of these African immigrants who were crossing the Mediterranean and in boats and capsizing and dying, who were coming in. And so there was all this context of a crisis. At the same time, that sparked sort of this anti-migration movement in some countries, including Denmark, where I was. And there were these right-wing political parties that sprang up to oppose this influx of migrants. So that pushed me into really wanting to help migrants, myself being one of them, right? In Denmark, and the rhetoric was so negative that if you're black and from a non-Western country, you were not wanted in Denmark. You were not wanted in Europe. And so I was in the middle of all this. I'm trying to work. I'm trying to find work. And so I thought, what could be the best way that I can be a part of what's going on? And that was to volunteer and to work with unaccompanied minors. And so I was there at a time when it was a huge crisis, and all these right-wing political parties. It felt very dangerous, actually, to work in that area at the time. Some of those parties are still in power, of course, particularly in Denmark. They're not as strong, but Danish People's Party is still there. But they gained a lot of their political support from 2015 onwards, opposing migration. And so that for me was a turning point in even my career in terms of research work. And I thought, I'd been working around HIV/AIDS and thinking about the children and so on. But then here I was working with migrants and unaccompanied minors, and that really shifted what I wanted to do as well. And so that sparked my interest in understanding sort of migration and integration and inclusion of immigrants and refugees, and how to better provide services and so on. So that's what I was doing in Denmark. And then, of course, 2018 is when I heard from a professor who it was when I graduated. He congratulates me. He's like, "Oh, Amana, there's an opening. This is a postdoctoral fellowship in Alaska, which aligns with your interests." And that's how I submitted my application and ended up coming here in 2018. I never wanted to live in Denmark, really, and so it was a good time for me to get out of Denmark, given what was happening. And so that was kind of the general context that was happening professionally and also in my personal life. I said, I need to move to somewhere else. So, yeah.
Well, you're a well-traveled social worker, my friend, and I was also just like me, really. But I was also thinking that your story is different than mine, but it's also similar. Is when we tell it, it almost sounds like social work chose us, like that we were already kind of doing the work before we connected that to the specific field of social work, and then somebody or whatever, they came along and said, "Hey, did you know that you're a social worker?"
Right, and that those things happen, and sometimes I even tell my students there are things that we plan, and then there are things that actually happen in our lives, and particularly in our career paths. There's one thing that we might really want to be interested in and are really interested in, but then life happens. We have our networks and things, people who refer to us to certain things. As long as that doesn't remove you from your core values of how to serve people, I think it's a common story of people shifting around a lot, right, in terms of their career paths. But I've always found grounding in being able to serve people. That's kind of the core that is always there. And locations can change, but I think those values will stay intact.
Sure. Well, I'd like to talk more about that in a minute, but we have one of my students, Ian, is calling in right now with a question, so I'm going to bring him on. What's up, Ian?
Not much. How are you doing?
Good. Ian's he was just here in Alaska not too long ago, but you're in Buffalo, New York?
I'm a little east of Buffalo. I'm in Rochester, New York.
Oh, Rochester, New York.
Yeah.
Right on. Thanks for
Hello,
calling
Ian.
Hello, how are you? So yeah, I just had a couple questions that kind of overlap a little bit, but Did you have any interest with, like, did you have specific drive in going to work with people with HIV, or was it something that just kind of fell in your lap? And overlapping that is, did your work with HIV extend into working with your work with migrant children?
Good question. Yeah, thank you, Ian. So the drive was working in HIV/AIDS was it was an immediate problem in the country. This was happening. A lot of people were dying in my country. A lot of children who were going without their parents. And I had already started working in the community, and I saw that firsthand. It wasn't particular to HIV/AIDS, but I had also been working with other areas of need, such as children with special needs. At the time, we called it special needs. Because they were being excluded from going to school. So there was a lot of stigma around disability. And so then in that same context area, there's also stigma around HIV/AIDS. So because those were problems that were happening around me, it was kind of a natural segue into focusing on HIV/AIDS. But this was a problem that was top of the national priorities, if you will. So there's that. Everywhere you heard over the radio, they will talk about the problem of HIV/AIDS, right? So that drove my passion and interest to work with that and address stigma, either with HIV/AIDS or people with disability, particularly children. So it wasn't really. My drive was that I wanted to work with people, but I think concurrently there was this external message that was coming in about the ravaging impact of HIV/AIDS, right? And national priorities too. You know, the government had set priorities for addressing HIV/AIDS just because of the scale of loss of life, particularly of economically active population. You know, HIV/AIDS was hitting the younger population, the 18 to 24 right there, you know, and the government was saying this is the core of the economy in our society, but also because it's hitting a lot of parents, it's also leaving a lot of orphaned children who are being looked after by their grandparents, right? So we have grandparents, we're supposed to look after our grandparents, but in this case, it's been reversed, where grandparents are becoming the mothers and fathers of the younger generation. So the impact of HIV/AIDS was so widespread in the society that the government made it a priority. And so my graduating and getting into the labor market coincided with that, what was happening nationally in terms of the priorities around HIV/AIDS. The focus on children continued, but not the migrant focus, right? So I did. So when I worked in Tanzania, I was working with families that were generally affected, children, mothers and fathers. But when I moved to Chicago, I found a very different profile of people living with HIV/AIDS. In Chicago, we had to deal with children whose parents were HIV positive, but they may not necessarily have been infected themselves, right? And then I had to also work with men who are having sex with men, who are another bigger group of infected. So that was different. It was still around HIV/AIDS. The only similarity there being the children still continued in Chicago, but men having sex with men wasn't what we dealt with in Tanzania. The predominant ways of transmission in Tanzania was heterosexual relations. But in Chicago is mostly men having sex with men. But at least a common thread of children. was there. When I went to Denmark, the common thread of children was still there. However, HIV/AIDS was not the issue. So in a way, you could say HIV kind of got lost when we started dealing with when I worked in migration and unaccompanied minors. I was not having access to records of the medical records. Perhaps that was one of those things, but we didn't really look at that, at least from my point of where I was serving them. I was mostly doing service navigation, integration services, and so on. Somebody else took the children to the hospitals for medical testing and so on. So I think there was a common thread of wanting to work with children and families, but in Denmark, the HIV/AIDS part kind of fell off as I was working with around migration challenges. I don't know whether that kind of answered your question.
Yeah, it did. Absolutely. Thank you very much. I appreciate it.
Yeah.
Thanks, Ian.
Now, nowadays, people don't talk a lot about HIV/AIDS, right? And I think that's a problem, because HIV/AIDS is still a problem, right? And even here in Alaska, I know that's not so much talked about, but I think it's still an issue that is worth looking at, because we know that the cases of HIV/AIDS are actually going up among younger populations and other sexually transmitted diseases too. So, yeah.
Yeah, I'm not sure about Anchorage or other places in Alaska, but I actually volunteered in Fairbanks with the IMAT, Interior Medical, but it's the Interior AIDS Association, and they also do medical addiction treatment. But it was a great organization to volunteer with, and they do a lot of outreach throughout the community. So,
yeah, and with HIV/AIDS, there's other co-occurring issues, right, with substance use and injecting drug users and so on. It will be a mistake not to, address HIV/AIDS alongside these other challenges. So,
right.
Yeah.
All right, thanks, Ian. I meant to ask you before we move on, Amana, what's the weather like in Tanzania? What's the climate like over there?
Yeah, right now the weather it's pretty warm, even if it's kind of our winter season in a way. Not really. It's like the heavy rain season. It's relatively cool, so it'll be something in the 60s and 70s. Right now they're 80 something. In the coastal areas, it's a lot warmer. Obviously, but it's much warmer than Alaska.
Yeah, one of my first memories, I moved up to Barrow Utqiagvik like a decade ago, and it was summertime, and it was like, I don't know, 45 degrees outside or something, and sunny, and the wind wasn't blowing very hard, and they're like, it's so hot today. Everyone kept saying that, and I was like, I don't know what your definition of hot is, but it's definitely not hot. It's just not that cold.
That is true. That is true. And one of the things that people ask me is like, why would you go to Alaska? And you're from Tanzania. I'm like, how could that happen? But yeah, I think sometimes I tell them, though, that Chicago was colder than Anchorage. So it's just that we get long winters and a lot of snowfall, but it's not that cold compared to the chill factor in the Midwest and Chicago in particular. So it's become bearable, but of course I miss the sun, which is why I'll be heading out right after spring break. I have my ticket for May. I need to go and get some sun.
We do too. So, yeah. Yeah, it was a bit of a hard winter. I think it was all quite mild by Fairbanks standards for the most part. And this is our first winter here.
Oh,
But then in January, it was like minus, maybe it was February actually. It was like minus 50 for minus 40, minus 50 for like 2.5 weeks. And then the next week it was 45 and the snow was melting off all the trees. And it was out. That's crazy. That's like almost 100-degree turnaround
yeah.
in a week.
Oh, yeah. It's been rough. It's been even I felt it when it was minus 15. Um, for me, that's really cold. In fact, my that's the one thing my wife remembers here is it's very cold. She doesn't like it. So, uh, so but hopefully, you get used to it with time, and you realize it's not as bad as perhaps people imagine it to be.
Yeah, I don't think that. I think it's a little over exaggerated, but the darkness and the cold can get to you after, if you're here long enough for a long enough period of time. We're used to have, I mean, most people are used to having sunlight and they're used to being able to go outside. And so when you're prevented from doing that, it affects everybody's health and their attitudes and whatnot. But I do have to say, there's some champions out here in Fairbanks that go out in 50 below and are running, out there running and things. That's not for me. Once it gets about 15 below, I'm probably not going to spend much time except for maybe going to the vehicle and back.
Yeah. It's not good, right?
Well, you said you've been here for a couple years now?
Yeah. So this is my 5th year. I came in 2018, as I said, in December. Specifically, 9th of December is when I arrived. And that's 2 weeks after the earthquake, if you heard about the 2018 earthquake here.
Yeah.
And so when I got in, it was dark when I landed. I landed 4 in the morning. The director of our school was at the airport to meet me. It was dark. He drove me to my apartment. It was dark. I went to bed. I woke up. It was still dark. And so it was quite a reception. And so because of that earthquake, you could even see some buildings were still had their cracks, right? And so here, on my first day, it's all dark, and they've just gone through an earthquake. In fact, they're just clearing up some of the debris from the earthquake and the devastations of the earthquake, and so and trying to figure out a new place to live and a new job and so on. It was quite a I say it was a earth-moving, earth-shattering kind of an arrival because so that was 2015, and so I came as a multicultural postdoc fellow. They had that. It was a multicultural program they had under the provost, which was I think the goal of it was to help diversify faculty and bring in more researchers and fellows who are interested in the areas of multicultural kind of work and support work of diversifying faculty. So that's what brought us. In fact, I was one out of a cohort of 6 of us at the time. And so I was placed in social work, and some of my other cohort members were in different other departments. Unfortunately, that program was discontinued after the 2018 budget exigencies and budget cuts, and so that meant that they had to change, and so they don't have that program anymore. But I was fortunate in 2021 that I was offered a tenure track position in the School of Social Work, and so as of 2021, I've been on a tenure track. Unfortunately, I think from that cohort, I understand that I'm the only one who remained here. But I think you would say there were many pandemics, right? There was COVID, and then there was the budget pandemics that we were going through, and it really impacted a lot of things, including the program that brought me here. There is some version of it that is happening right now, but not quite. It's not a cohort model. It's changed. I don't think it's called that same name anymore. But yeah, so that's what brought me here, and I've been doing work around HIV, working with migrants and refugee here in Anchorage. But also, as a result of COVID, I also got roped into issues around addressing the Black health of Black Alaskans. And so I led the first health needs assessment of Black Alaskans in the period of COVID-19. So that's what I've been doing since then, since 2021, and now I'm preparing my 4th year review file. So soon it'll be 4 years of tenure track, and see how it goes, and maybe I'll be preparing to get my promotion and tenure file done. So so that's the journey at this point.
Yeah, congratulations on the tenure track. Seems like UAA is lucky to have you. We have another student, David's calling in, so I'm going to bring him on real quick, and then we'll circle back and maybe talk about some of the stuff you've been doing here in Alaska.
Hey,
David, you there?
You can hear me?
Yeah.
Okay, great, guys. I'm going to keep my camera off because I'm having some issues over here. But it's a pleasure to meet you, Doctor. I really appreciate this opportunity to be here with you guys. You just actually touched on a question I had about what you found out when you connected with the Black Caucus, because I've actually connected with the Black Caucus, and my wife, who's an educator, has also connected with the Black Caucus here in Alaska. I'm a Black man in Alaska, but since you answered that question, I want to kind of go back real quick to something you said earlier about the Tanzanian languages. Has Tanzania created any programs to preserve, to bring back the tribal languages? And if so, and if not, what could we do, or what can be done to do that? Because I live in the villages here in Alaska up north. I'm from Detroit, Michigan, but unfortunately, we didn't have that issue there. But we have that issue here with the Alaska Natives here. What programs have been started in Tanzania that can maybe be translated to a program that can be actually started here in Alaska? And I'll quiet down so you can answer that.
Yeah. All right. Well, thank you, David. Great questions. I'll start with the Alaska Black Caucus one, and then I'll move to that. We found a number of things with the Alaska Black Caucus, which is a lot of Black people have health challenges that go unmet, are not recognized, are not addressed. Diabetes, chronic health conditions, mental health conditions. In fact, more compared to the Alaska Native and the white population of Alaska. And so what we also found is that the experiences of racism and so on in the healthcare system. So this was a two-part kind of approach that we utilized. One, we looked at kind of secondary data, what is available out there using CDC data, state information data, and compare to Alaska Native, white, Native Hawaiian, and other ethnic groups in Alaska. So that was our approach. So we could actually look at what are the main causes of mortality for Black people, suicide, diabetes, mental health, and so on. In each of those, except suicide, I think, and death by firearm or something. Well, suicide mostly. It's the only place where fewer Black people are dying from compared to the other groups. And so if you look in many areas of cancer, still the Black community, of course, has a higher rate of mortality as a result of that, but also of morbidity and unmet needs. The challenge is, of course, these are not highly representative numbers. We had to deal with a very small sample of Black Alaskans. I think we're about 3.44% maximum of the 700,000 people in the state. So you're talking about 25 plus thousand, right? People who are Black. But nevertheless, I think even with the small sample size, we were still able to determine sort of the health disparities between the different tribes, the different ethnic groups. And so what we're using that information now to sort of develop programs that target the Black community in those different areas of mental health. One of the things that was raised was the lack of healthcare providers from the Black community. And so now we are developing a directory of Black healthcare providers with the Alaska Black Caucus, where if somebody wants a peer sort of healthcare provider, they can go into this directory and find them, right? We are also looking at how do we address issues of diabetes within the Black community through a culturally affirming sort of programs. For instance, how do you still maintain a healthy diet without changing the foods, right, that people eat and so on? Because the discussion always is that ethnic, whatever that means, right? Ethnic foods are not nutritious, right? But how do we still enjoy our meals and food in a way that does not compromise our health? So those are the programs that we're now moving into, from the assessment, from the we know what, to the actual actions. What can we do in order to address the challenges that we have met? Similarly, around issues of mental health, we're really trying to develop programs with the Alaska Black Caucus to target those areas that were identified in the assessment. So that's going well. Currently, actually, we just got a grant from the municipality of Anchorage to do healthcare outreach, but particularly targeting COVID and promoting vaccinations and addressing misinformation, and also hitting on issues of some other barriers to healthcare access. So I think that is just a continuation of the specific programs that we can implement to address the problems that we saw in the assessment. So that assessment has been working. It's been sort of a kind of a guiding template for the different works that we'll be doing with the Alaska Black Caucus. So on the what the Tanzania government is doing to address the language issues with the tribes. Unfortunately, nothing that I can say. I don't know of a program that is being implemented by the government of Tanzania to address the sort of the dying indigenous languages. And this is the reason. Initially, and through the first president was his understanding of conflicts in Africa and why Africans were not developing. The thing that he blamed the most was tribes and tribal languages. So he thought that if we can address the problem of tribalism, in different languages and focus on promoting Swahili, we will be able to address the problems of poverty and conflicts between the different tribes. So at the national level, it's been really difficult to have a conversation about how do we revive and protect and revitalize these languages of the tribes, because then you'll be going against the official policy of the government, which is basically to say, we don't want these small languages, right? They want to build on Swahili. So there is a National Swahili Council. They promote Swahili. They don't promote the other languages. That's a problem. So I don't know of any program that is specifically targeting these small tribes, because I think that will be contrary to the ruling party's policy on promoting Swahili and effectively actually killing off tribes. So there's always this tension. It's a lot of tension between what the government wants and what the different tribes want. So if the tribes want to promote that, those are mostly at the tribal level, if there are any programs, which I do not, and those will not be at the national level. At the national level, they would only highlight the different ethnic tribes, but not an actual program to maintain these languages, right? It's kind of the ideal model of multiculturalism, right? They will celebrate, oh, we're a multicultural society, but actually they want to promote Swahili. So they can only highlight, right? Oh, these are wonderful tribes, they have these practices, but we don't, right? But they won't talk about how do we revitalize their languages, how do we make sure that their languages are preserved. So unfortunately, I don't know of any program that is specifically being pushed by the government to preserve indigenous languages. So that's a good one. I need to look up, but I don't know, because the official policy has been to promote Swahili as the national language, because the problems of Africa have always been seen to be the different tribes that are, fighting against each other, and that's because of the different languages. So, I disagree with that policy. I'm a big supporter of. From what I was sharing is, I want my children to learn my tribe language. I want them to know the languages I do. I want them to go through the rites of passage that I went through. I want them to learn and know where they come from, right? But that is not what the government actually wants. They want you to speak the national language, which is Swahili. So you could even think that what English is doing to other languages is exactly what Swahili is doing to the indigenous languages. Did I get to your question, David?
Absolutely. I really appreciate that, because it's almost as if there's a lot of antidotes that can actually change this. But unfortunately, I think that no one is actually embracing some ways of actually creating the differences. So I appreciate what you said. Thank you.
Yeah, it's all about assimilating, and I think it's the same policy here. Is assimilationist, to make sure everybody speaks English, right? That is the official policy.
Right.
If anything is done outside that, it's considered woke or anything, right? That's outside the mainstream. But the official policy is assimilation. And I think these governments, even in my country, they're pursuing an assimilationist policy to get the different tribes to forget their tribes, to forget their tribalism, and identify with the national identity.
Absolutely.
Part of that has succeeded, because Tanzania is considered one of the most nationalistic countries in Africa. And one of a few countries that actually have a strong national identity. But that comes from the policies of Ujamaa. I don't know if you guys have read about that, yeah? Ujamaa and nationalism, which was very strong. and very effective, to build this sense of oneness and Pan-Africanism, right? The first president would rather you identify with the country and the continent instead of the tribe. So he was a strong Pan-Africanist and a strong nationalist. And those are the policies that dominate today. Tanzania is the main diplomat in Africa. If you want to talk about how do we build nationalism, people go to Tanzania to learn about that. They went there in the 60s, right? Tanzania led the liberation movement for all the other countries in Africa, and particularly in Southern Africa. Even Malcolm X was in Tanzania.
Absolutely.
Right. They all went there to learn about Pan-Africanism because, he was a great president. He was great. He had these ideals of building a one united Africa. And he succeeded because we view ourselves very much as a nation. And he managed to kill off a lot of those tribal affiliations. So. Mm-hmm.
Thank you so much. I appreciate that. That One Africa nation, that's another question for another time, but I'm glad we have you because honestly, I'll just say that's another question at another time because I've read so much about that. I've heard so much about that. I'm so interested in it. And but thank you so much.
All right. Yeah. Cool.
Thanks, David. Ian, you had another question? You're on mute.
Yeah, so you've been to multiple countries and you practiced social work in multiple countries. What kind of differences and barriers of providing services to the people did you experience? Like, is it pretty equal, or is it like certain countries are more difficult to provide those services than others?
Well, great question. You're asking really good questions, guys. I think I've had some good lessons to reflect on this, because when I look at the U.S., Denmark, and Tanzania, I think they offer very unique case studies. I think one is Tanzania is a poor country, right? So that's very different. So in terms of how do you provide resources in a lower income country, that is a different question, right, than you would have if you're in Denmark or the United States, right? So that in itself is, in fact, the HIV/AIDS program I was working in, who was funding that? That was funded by the United States. It was a USAID program under PEPFAR, right? The President's Emergency Fund for HIV/AIDS, that they were bringing in money. So you have providing social work in a low income, economically dependent context. That's very different, right? You are having to listen to, maybe some instructions from Washington on how, right, the donor, those who pay, also define the priorities, right? I mean, you can try as much as you can to be neutral and so on, but the bottom line is there's somebody here who's giving the money to do the work. Without that, the work will not happen. So even the HIV/AIDS work that we're doing, for people to get on their meds, the HIV/AIDS medication, they were free. Who was subsidizing that? It was the U.S. government. It wasn't the Tanzanian government. So they have no say. They just accept it. Because if you want your people to get the medication, you accept it. Now, I don't know that I can say this on your podcast, but there's some strings attached, right, to all these aid conditions. If we're giving you money for your people to get treatment around HIV/AIDS, maybe that deal is dealt with some other way, right? There's maybe a little bit of gold, right? I mean, I don't know. What are we given, right? There's something else that is being given. So you're providing social work services in a low income, economically dependent country with strings attached. They are really depending on that. It's a life-saving medication, and so you just have to accept. I don't know what the conditions were, right? But I would tell you that I don't know who's going to listen to this podcast, but those reports were reviewed somewhere else outside Tanzania, right? So we do the work, the reports go out, somebody has to review them. They were not being reviewed in Tanzania. So that's a different context altogether. You don't have much resource, you're economically dependent, and there are people who decide what the priorities are who are not in those villages where we were working. All right, so that's one context. In Denmark, it's very different. It was around 8 migrants and so on. Again, they right there was a heavy welfare state. These services were being provided by the government, right? The Scandinavian model, right? So they get to decide so much. But I think also the resources were not a problem. I think the problem there was a lot about politics. As I said, it was these right-wing anti-immigration parties that were in power. So those decide what you get. All right? But there was also language issues. For me, it was also a language barrier. I had to speak Danish. It's a totally different context. To receive services, to be able to provide services, there's very little that I could do because there was so much I could not understand because of the language barrier that I had. I mean, you're supposed to learn the language. I went through integration program, through language program, but still, I wouldn't say that I was comfortable in the language of Danish. So there, it was mostly around that. And I think the difference between the United States and Denmark is, whereas you have a very strong state-led welfare model, here you have a mix of all that, right? You have non-state providers, even faith-based, right? Mostly faith-based providers in the United States, who determines what kind of services you can provide. And also like a lot of grant writing, I could feel here you have to apply for grants to actually get the work done. In Denmark, you don't apply for grants; you just come free. For those, health insurance, as long as they were registered as unaccompanied minors and therefore they were seeking asylum, once they were granted that, they could access healthcare in the hospitals without needing to worry about, how do you pay and whether they have health coverage and so on. We didn't have to apply for grants, right? That came from the municipalities, right? The municipalities were actually providing the services, the funding to those. It is very different here, right? Where you really are competing to get resources. The resources are available. You just have to compete. You have to write grants. And you have multiple providers, right? That are, nonprofits. That is not the case in Denmark. In Denmark, it was mostly government-driven from the municipal level, and pretty much guaranteed healthcare services for the children who are unaccompanied, right? There is that. So there is a lot of differences depending on where you are. But the core part is there's a lot of politics in all these cases. Right here in the United States, depending on who is in power, depending on which party is in power, depending on who is running the different houses, right? That shapes who gets to receive services, particularly around migration. It also depends on the political context and political environment. It's the same thing in Denmark, right? Services to migrants. In fact, there were some migrants who were returned at the border, right? You heard about some who were taken to Greece. Greece was being paid by the European Union to harbor, right, basically keep those immigrants from getting into continental Europe, right? Like, keep them away. And in Denmark, they would even confiscate anything that had some value. You've heard of, like, wedding rings or something. They will take those away because they don't want to. If they're gonna put you on welfare, you should be really poor. You shouldn't demonstrate anything that would indicate that you can support yourself. But otherwise, they were pushed out because of the politics at the time. So some people were pushed out into Greece and so on. So the politics is strong, and in any country, I think you have to look at the politics. Whereas in a developing country like where I was, you have donor-dependent, kind of donor-recipient relationships that you also have to deal with. So all in all, it's like it all depends on where you're working. Ian, so
Yeah, thank you very much. That was all great information. I appreciate it.
have you thought about working across countries?
I have. I would love. I love the idea of it, but just pulling that trigger and just going somewhere else is just. I don't know. I'm safe. Not safe. I'm comfortable here, but yeah.
Excellent. Yeah.
Right on. Thanks, Ian. What's up, Lane? You there?
Hi.
Hello.
Hi, Dr. Mbise. Hi, Professor Stettler.
Hello.
I am trying to remember because I was very enthralled and enjoying the conversation and the information. I'm trying to remember what my exact question was now. I believe I was curious about. I remember you mentioned some of the Western effects and the comparison of language and how English has become a dominant language within, a lot of Western societies and just even countries within that are kind of reliant or under Western power. Like Western countries kind of, I guess a good example is kind of like, Japan and the US have had historically a very close relationship, and now English is taught in a lot of Japanese classrooms, from my understanding. But I was kind of curious about how you feel some of the Western, because I'm from the US. I'm raised in a Western culture, and I don't have a lot of firsthand experience that you have. So what I'm curious about is what are some, I guess, other ways that Western society and kind of the effects of colonialism and like the overwriting of language is a great effect, but what are some more effects that still are prevalent today, I suppose? Trouble finding the word there.
Yeah. Uh, I think one's language is who you are. And language is really more than just the words, right? It's the core of who you are and how you understand yourself. And sometimes even being able to speak one's language might not even be enough to really be able to understand how, like what it would mean to be able to be born in that language, to be a native speaker, and then have that taken away, right? It's huge because so when I think of my own tribal language, I don't know how else I can understand who I am if I didn't speak that language, right? It's when I was born. That's the language I spoke. That's how I can. That's how my primary identity is that of my tribe, and that comes through my language too. I can express that through the language. So you take away my language, you're really taking away who I am, right? And so if you think about that impact of English on these mother tongues and tribal languages, is huge. It's huge, right? You're taking away a core part of how people see themselves and identify themselves, of who they are. And that is the trauma that can be long lasting, and perhaps that is impacting a lot of people who have been colonized, because you're dismembered, right? It's like this writer who talks about dismembering of our minds. You're basically dismembering us, right? And so that is a long lasting impact on people, and it can have other outcomes such as health related outcomes, mental health, substance use outcomes, right? All that, right? So I think it's important to address the impact of the English language and the colonizing power of the English language on on people who have been sort of dismembered from their being through their language. That impact is greater for people who perhaps spoke a language and they realize it's gone. Maybe not so much for the younger generation who have never really spoken it, right? But still, when you want to reconnect, you don't know who you are. It's difficult. So the impact is that, of course, you won't see that language, but I think deeper is a community that is completely dismembered from its own identity, and that is huge. When I even think about my own example, like when I switch, so I can, I go from English and I speak Swahili, but when I speak my tribal language, it's a different. You got all these multiple personalities, right? You're shifting to different people. The tone is different. You're thinking. I don't know what part of the brain is thinking at that time, but you're becoming somebody else. You're not just changing words. You're actually changing the person as well. So removing that could have very lasting impact on the core of who you are. I believe, right? So, yeah, I mean, it's. That's the colonizing impact of English. It's so powerful. It's so powerful, and the force of it is almost irresistible. So countries which are considered very close knit, like Japan, right? Who would have thought countries like that would even accept? But they're now teaching that. In Denmark, they just had a policy on teaching English from primary school. Right? That was never the case. These are very strong countries that have very strong, close-knit communities, but still they're saying it's time to open up to English because it's irresistible. I don't know about China, what's going on in China, but even yeah.
Well, thank you so much, Dr. Mbise. Yes, I guess what fascinated me about the language and when you were talking about it made me think about how within the US, especially within the academic setting, how language is thought of. Because going through high school, everybody chose a language that they felt it felt like useful, is what I noticed. A lot of people chose Spanish because it was the second most spoken language in the world or whatnot. And I realized that utilitarianism is this huge part of Western culture. However, it only considers the utility that the Western culture feels is useful. It doesn't consider what other cultures feel is useful, and it doesn't also think about it in terms of a beauty or an art or again, cultural perspective. Is like, oftentimes you can go to an art museum, you can appreciate the art there, but it's as if when we see language in this country, we don't consider a language to be art. And it's something that I feel I am more I'm learning more about in the recent years.
Yeah, and I can tell you, even with, in my home country, the way they talk about why we need to teach English, it's very much that utilitarian. It has a very instrumental value for, we need to be a part of the global world. We need to be able to get jobs outside Tanzania. So the government is framing it as, it's important because that's the only way we can be a part of the global community. We can assimilate to the global community. We can get jobs. So it's got economic benefits. If you can work in many countries, but also you can work remotely, right? You can be in Tanzania and you can be doing work in the United States and so on, because they value that as, a politician can run on that, right? This is how we create jobs, right? If we can just learn English and be a part of this global community. But language is not just about, the end goal. It doesn't have an end goal of a better job, of a better pay, right? But that's the strong utilitarian perspective that is dominating. So yeah, unfortunately, I see it every day, and they're revising policies in my own country where now English will be the medium of instruction from primary school in national school. I mean, yeah, so in public schools, they're doing that because they feel, you see, look at the Kenyans. Kenyans are really good in English, but Kenyans are getting jobs outside their own country. We can do that. Or Ghanaians or Nigerians. That's because they teach English from primary school. They introduce it early. And so now that's the movement. And so now they've been rewriting the education policies so they can include the learning of English and the English as a medium of instruction right from the first grade.
I do think a universal language, um, the presence of one, I think is an aesthetically appealing, and just it seems like a nice idea because, but not in the substituting of a cultural's language, another culture's language. I think the idea of being able to go to any country, any place, and still have a medium of communication to get to know those people, to be able to speak to them. I think the idea of that is nice, but the problem is, again, as you say, the method and the way that it's been done has been overriding cultures rather than in conjunction with.
Mm-hmm. Mm-hmm. Yeah, and it's. I don't think there's. Perhaps there are some model countries that have managed to do that, where they're able to teach both of those languages concurrently and effectively. But where it fails is when you have smaller tribes, these small languages. How do you do that? Because right now they can teach. I can assure you they will be able to preserve Swahili and English. I mean, not a problem there. They can teach both because Swahili is still very active in the country. They're learning. Everyone is speaking, and English can still be side by side. But the tribal languages, who is there to support them? That's where the problem comes in. Those ones are getting effectively killed off, basically. So, yeah, I don't know, but maybe there are some truly multilingual countries, and I don't know which ones those are. Would you say Canada? Well, in Canada they have English and French, but there's some. I'm sure the French side would argue otherwise. They would say that they're not quite.
There's also the erasure of indigenous language within Canada as well.
There's
That's
exactly
right.
yeah.
I also wasn't speaking just to English being a universal language. I did not mean for it to be assumed that. I just meant, personally for me, I find it almost, I don't know if romantic, but I find it sweet, the idea that you could go to any country and be able to communicate with somebody,
Yeah.
without having, I think that in and of itself is a neat and pretty idea, is I guess a good way to put it.
Yeah,
Um,
in fact, I love it that I can go from Tanzania and I can travel in so many countries and still be able to speak Swahili. It's great. It's great. In fact, I went to the Catholic Social Services here. There's a lot of sort of the refugees, and I walked into Catholic Social Services office here last week, and and I saw this three people who were sitting right at the entrance, and they're speaking Swahili, and I could easily start a conversation with them. That's nice, out of nowhere in Alaska, I'm speaking Swahili, right? And they are from Uganda and Burundi, and here I am from Tanzania. So that's beautiful, right? That it could really connect me, and it made them feel, oh, they just recently arrived in Alaska. I'm sure they were more surprised than I was that here there's somebody who's speaking their language. so, so yeah, it's ideally it's great. But how do you do it without displacing the indigenous languages? Yeah.
exactly.
All right, thank you, Lane. That was a
Absolutely.
great. That was a great conversation. Well, Amana, we've been talking for a long time now. It's like about an hour and 45 minutes. I just had one thing I wanted to ask you before I let you go, and it was what kind of teacher are you? What kind of professor are you? What kind of pedagogical styles do you use?
Well, that's a good one. Because I'm actually trying to define that exactly for my fourth year review. So it's a good practice because I think I view my scholarship as mostly community engaged. I find value in working alongside communities, and I try to bring that in my classes through service learning projects or community engaged type projects. I teach classes in capstone development, which is about out there in the community. I'm teaching working with communities and orgs and organizations. That's again, I give them projects. I give my students projects to do outside, partner with a community-based organization, because I believe that learning is most meaningful when it is applied to real-world situations and in the community. So I think that's where I found even myself. I flourish best in that area of community engagement, and I've also seen that students learn best when they can see the real-world application of what we're learning in class. But it's also more challenging because it's raising questions that are perhaps not addressed or dealt with in the classroom, right? In a way that is much better than what I can tell them in class. I'm like, those are the teachers. The best teacher is actually out there in the world, right? Go and grapple with that question, bring those questions in class, and we'll talk about them. But I think that's how I view my social work practice as that is mostly community engaged, and therefore community engaged scholar. I would even invite guest speakers who have sort of those lived experiences and experiences to come and talk to my students when I can. Some classes are less amenable to that. I'm teaching a research class actually for the first time, and there's been fewer points where I feel I can bring in a guest speaker from the community. But even in that, I'm asking students to come up with a research project and that they can actually do in the community. So as much as possible, I try to bring in that community perspective to my classes and to my scholarship. Even the work that I'm doing with the Black community of Alaska, that's primarily with the partnering with the Alaska Black Caucus, partnering with other agencies in the community. That is, the ask even is coming from the community. They say what is needed, and I view myself as responding to and helping to address those challenges. But I think the core ask is emanating from the community. Likewise, with my immigration and refugee project, that is mostly community based and community engaged. So I work with Catholic Social Services. I work with it's called the municipality of Anchorage. They have a welcoming center that we've worked with them. We've worked with the Peer Leader Navigators, which is a healthcare navigation type model that is run by immigrants and refugees. So we work with them to help with the outreach and data collection and so on. So I view my research and my scholarship as primarily community engaged.
Yeah, thank you, and I appreciate your answer. I think the status quo is often just the banking model of education. Come and deliver it and give everyone an exam, but that especially doesn't. I don't think it works well in most, if not all, educational settings. But it especially doesn't really make sense in social work. So I really appreciate hearing from folks like you that are doing things different. Bringing values into the classroom.
Yeah, no, I appreciate it. Yeah, because traditional education is just sort of this the ivory tower, as if we know it all, right, at universities, and no, I don't think that is true. There's a lot of knowledge, but I think we also obtain our. That's how we demonstrate relevance. If what we do is not relevant to the community, to our communities, then I think. We're not doing anything, right? So it's also I view it in that regard as legitimizing and building relevance for our work.
Absolutely. Well, I appreciate you taking the time to talk with me this Sunday afternoon. If you're anything like me, then it's a super busy time of the year. I think I'm calling it Hell Week coming up because I have so much going on this coming week. So I will get on this podcast probably next weekend and get it uploaded, and I'll send it over to you. But again, many thanks to you from the bottom of my heart, from my family to yours. I really appreciate you taking the time. It was a pleasure speaking with you. I appreciate everybody that had comments in the chat, and that especially the ones that called in. I felt like that's always one of the best parts about this podcast is when we have more than me and you can contribute in that other folks are chiming in. So I really appreciate y'all. I hope you all have a great rest of your Sunday. Maybe some of you are watching. I think the NBA All-Star game is on. It's funny. I used to be so into that kind of thing, and I care a little bit now, but not so much anymore. I don't know if it's busy, kids, family, or whatever, but I just can't get into it that much anymore. But anyways, I just want to give you a chance for any last words before I let you go, Amana.
No, I truly appreciate it. I really enjoyed our conversation. This is great. I appreciate your reaching out as well. And I know we had a few back and forth and trying to find the right time. But you were full of grace to really be patient, and that we were able to find a time, and even when technology wasn't cooperating with us here.
Yeah.
No, I truly appreciate, and I want to commend you for using various ways to educate, and podcasts are one such way that I've even considered myself to provide, to disseminate, and to communicate research and creative other ways to
to reach communities and engage with the community. So thank you so much for having me.
Yeah, and if you ever want to talk about that at all, if there's anything I can help in that regard, because I've been through it now for a year, and it's a rocky process. But if I can help and contribute in any way, I would be happy to. Don't hesitate to reach out, and I hope, my friend, that we can talk again, and maybe we can shake hands and meet in person someday.
Absolutely, I appreciate it. Thank you, and best wishes and all the best for your family as well.
All right.
Thank you.
This episode was recorded live on Sunday, February 18th, 2024. This episode featured Dr. Amana Mbise, professor of social work from the University of Alaska Anchorage, and it was hosted by Christian Ace Stettler. Brought to you by the University of Alaska Fairbanks Department of Social Work, this has been a Conscious Party production. You've been listening to The Critical Social Worker, a revolutionary storytelling podcast. Your story, my story, our story. All right, everyone, until next time, keep being revolutionary. Peace.